Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith-Rogers. Today, the topic is contraception and the fight to keep it legal, even in 2023. Stephanie Desmon talks to Dana Singiser, a former Planned Parenthood executive who's working to ensure contraceptive access and rights in a time when both are at risk. They talk about the need to codify the right to contraception into law and what's next for over-the-counter birth control. Let's listen.
Dana Singiser, thanks so much for joining me.
Thanks so much for having me today.
So you are involved in a bunch of issues around contraceptive rights and access. And I'm wondering if you could tell us a little bit about those roles.
Sure. Well, since I left Planned Parenthood, where I spent about 10 years of my career, I've really, particularly in the wake of the Dobbs decision, gone deep on making sure that we protect and expand access to contraception. And I do that wearing my hat as co-founder of the Contraceptive Access Initiative, which is dedicated to getting the oral contraceptive pill over the counter and affordable to all. And also as a senior advisor to an organization called Americans For Contraception, where we are working to codify the right to contraception in this country. As you may have read in Justice Thomas's concurrence in the Dobbs decision, he sort of questioned whether the right to contraception and other rights that are based in that right to privacy that abortion is also really are foundationally strong still. So essentially it was challenging the basis for the right to contraception. So it became clear that there was a need for an intense effort to really codify that right, since we can, frankly, unfortunately, no longer count on the Supreme Court to do that for us.
So how do we do that?
With a straight up bill to codify that right. Rights are derived in a couple of different ways in our system of government. The Supreme Court can sort of recognize that right in the text of the Constitution, or legislative bodies can establish that right through legislation. So ultimately, of course, we want a federal right to contraception codified in federal legislation, so it applies to people in all 50 states. Barring that, we also need to just be making sure we can pass it state by state. And fortunately, there's an effort underway to do that across the country as well.
So we really think that this is a real threat.
Unfortunately, as we sit here in 2023, it is a real threat. And really, you see the breadcrumbs across the different forums of government and across the country where contraception really is under attack. I mentioned Justice Thomas's comments in the Dobbs decision, but that bill I was just referring to, the Right to Contraception Act, was actually voted on in the House of Representatives last year. And sadly, 195 House Republicans voted against that bill. 195 out of, I think, 203. So nearly all of them voted against it. You see in state legislatures across the country, state Medicaid programs trying to eliminate access to common forms of contraception like IUDs and emergency contraception. You see anti-abortion groups like the Susan B. Anthony list go after contraceptive access and the right. So unfortunately, you are seeing attacks both in the legal world, in the courts, but also through state programs of really denying access to contraception, which enjoys almost universal support in this country.
I mean, I find it so hard to believe. I mean, I know you just said in 2023, but it's just so hard to sort of fathom that these rights that have been around for more than 50 years, women have come so far, but there's this effort to turn everything back.
There is, I think, among the elected policymakers, I think what we are seeing is, particularly in the space of contraception, but also abortion, a real divide between where elected officials are and where their constituents are. When you look at the popularity of contraception, nearly 99% of the American people use contraception at some point in their lifetimes. if you do a public opinion poll, over 90% support the right to contraception. So putting aside the 9% who are somehow internally conflicted, they use contraception but don't support it. Putting them aside, 90% support for a public policy position is about as universal as you get. That means huge majorities of Republicans, independents, Democrats, rural voters, urban voters across the country support it. And yet you have this weird divide where their elected conservative officials, namely Republicans in the House and in the state legislatures, aren't respecting those views of their own constituents.
I will just continue to shake my head at that, and because I just can't fathom it. So recently, an over-the-counter birth control pill was approved by the FDA. Tell us about that. Is it in stores? Are lots of women getting their birth control this way?
Well, thank you for that question about the good news going on, because even as contraception is under attack, there is great momentum behind establishing that right, but also increasing access. And I'm so glad you lifted up a huge advancement that will effectively hit the shelves in the first months of 2024, which is the first oral contraceptive pill. This is the pill that people have been taking for over 50 years in this country, will be available without the unnecessary prescription barrier. So that means that you can actually walk into a Walgreens or a CVS or a dollar store and actually buy the birth control pill without a prescription. And this is exciting, not only because it, as I said, it gets rid of that unnecessary prescription barrier, but think of what that means for people who have less access to care in this country. And this tends to be people with lower incomes, people in rural areas, people of color, for whom accessing the system, getting an appointment, finding someone to take care of your kids while you have that appointment, paying whatever copay you have for the appointment can be a real challenge. And now you can skip all of that and safely access the oral contraceptive pill without that prescription.
But it's not the pill that most people take. Isn't that right?
Yes, which is why, as with anything with reproductive health, our work is not done. You are right to distinguish between the progesterone-only pill, which is one of the two main formulations of the pill. That is the formulation that will be available under the brand name Opill early 2024. The good news is that the other main formulation, the combination pill, which has progesterone and estrogen in it, is under review at the FDA. So we're hoping that will be on the shelves as early as 2025, 2026. So hopefully in the next couple of years, we will have both of those pills available to buy without having to get a prescription.
And the Opill is only used by about 5% of women. Is that right?
Yes. Different formulations are better for different people. So that is the one that just is the progesterone only. It has a shorter window for efficacy, as the label will clearly instruct, must be taken within a 3-hour window. The COC has a more forgiving window and has other drawbacks. So as is true with any medication, nothing is a one size fits all. Both products are great and safe and effective. So we are excited about that advancement for women in this country.
How do you think the word is going to get out to women that this is available over the counter?
That is a good question. I mean, obviously the sponsor will be doing massive advertising, but I think if you tap into sort of like any book club or any local community, moms listserv, I think there's an organic network of women and other people who can get pregnant who just share information about what's working, what's available. So I hope that those networks will be active and frankly have the benefit of the right information about Opill. It won't be a surprise to you that in addition to misinformation and disinformation around elections, there's a lot of misinformation and disinformation in the reproductive health space. So it's really important to look at the source of that information as you're spreading it to your networks and make sure that it's a reliable source. The pill is incredibly safe. We know that from our lived experiences over the past 50 years. But I hope that those networks of people are sharing information, sharing their personal experiences, and doing all the TikToking and Instagramming of really sharing what it looks like to have access at your local 7-Eleven. It's just going to be revolutionary.
So health insurance, because of the ACA, I understand, basically covers the birth control pill. How is that going to work with this new over-the-counter pill? It seems contradictory in some ways.
Yeah, it's a really important point because, if you think of access of contraception, there's two prongs to that. One is how do you reduce any unnecessary barriers like a prescription that's not needed as determined by the FDA? The second is how do you make sure you afford it? And you're right that the Affordable Care Act passed just over a decade ago made birth control available with no out-of-pocket cost under most insurance plans in this country, which is fantastic, really expanded the access to different forms of contraception. Unfortunately, that law so far has been interpreted to not include over-the-counter methods. So right now, if you buy that same contraceptive product, whether it's Opill or emergency contraception or condoms over the counter, then it's not covered by your insurance, or at least it's not required to be covered. So that is another really important area of work to make sure that the Biden administration is looking at those regulations, looking at the laws, and closing what I think of as really just a loophole in coverage. There's no reason that something you can get by prescription is covered in that way, but not if you get it over the counter. And the good news is we're getting indications from the Biden administration, not only of their commitment to contraception, as they have made several times with executive orders, but just over the past couple of weeks, they issued questions for the public to submit information about what OTC coverage looks like. So they are looking for the best thinking, the best practical experience, what's good for consumers, what's good for retailers, to help understand what they would need to do to make sure that when you buy that contraception over the counter, it can be connected to your insurance and covered with no out-of-pocket cost. So it's really an exciting time for over-the-counter contraception to address those two barriers I talked about, this affordability barrier as well as the prescription barrier.
And what if you have no insurance?
We must absolutely make sure that we are looking at the 10% of people in this country who still don't have insurance. And there are ways that the federal government can incentivize federally subsidized health clinics like community health centers, Title X clinics, to make sure that people who don't have insurance can walk into those kinds of clinics and get Opill without any out-of-pocket cost.
Dana Singiser, thanks so much for joining me.
Thanks so much for having me.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmon. Audio production by J.B. Arbogast, Holly Cardinale, Philip Porter, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Fernandez and Shian Briscoe. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.